I'm Patricia Bales, and I'm a resident of Rolla for the last 50 years, and I was a business owner for all those years. And I'm married to Wayne Bales, and I have 2 children, a daughter, Diane, and a son, Jason. And Diane is a business owner of Kansas Aircraft in Kansas City, and our son is a major in the Air Force. I've been a private pilot for 47 years, and I was an active pilot up until just about 4 years ago. I was diagnosed with PDA at the age of 65. Well, the diagnosis is there's an artery at the top of the heart that when you're in the womb, it bypasses the lungs. But once you're born, closes. Mine apparently had never closed. And so I guess I didn't know any difference. I lived with this all of my life, so I didn't know that I had any condition, or I didn't know that it affected me any, and I had passed pilot physicals for years and it never had come up. The only thing anyone had ever told me said, "Do you know that you have a heart murmur?" And oh, it's just a mechanical thing, nothing matters. So, but then when I was 65 years old, while I was diagnosed with PDA, in about August of 2008, 6 years ago, I was home alone and I had some premature heartbeats. And it just kind of bothered me because I was getting ready to go take a flight physical to renew my pilot's license. So I was concerned, and so when my husband came home, I knew he had been a patient from Dr. Tom Martin for years, and I said, "Do you think Dr. Tom would see me and help me decide if this amounts to anything before I go for my flight physical? I would like to know and not be surprised by anything." We called the office and he scheduled me in, and Dr. Tom Martin assured me, he said, "It's probably nothing. I can't see that you have anything, and those premature heartbeats are probably nothing. It's kind of natural when you get older." But he still yet took me serious enough that he said, "Let's do an electrocardiogram." Well, it did show the premature heartbeats, but there must have been something he picked up, because he said, "Well, let's do an echocardiogram as an additional screening," and that's when it was discovered. It was a surprise to me that I actually had something wrong, but I was assured that we would go to St. Louis Barnes and have the procedure that would close that. And then, not that it was really dangerous at that time, because I lived with it all my life, but Dr. Tom Martin assured me that it might stress my heart in the future, and at my age I probably should have an intervention and have it closed. I feel better than ever, and I'm walking 3.5 miles 5 days a week, and I'm very active in everything that I do. So I'm just happy that I had it done so that I continue being active as I get older. You think there's something wrong, go have it checked out. And even if it's nothing, at least go have it checked out. And if they do find something, then I think you need to be not afraid and to have it taken care of, because it just would help me continue to have an active lifestyle that I wanted to have. So I had it done. And I think anyone that has anything wrong needs to follow through.
My name is Briana Joynt. I have been married for almost 5 years. I have a beautiful 1-year-old daughter. I am currently the recreation supervisor with Rolla Parks and Rec Department. I've been with the Rolla Parks and Rec Department since 2010. I go to school full-time for a bachelor's in psychology. I have an associate's at X-ray, and I've kind of been doing a lot. I was diagnosed with a core triatriatum. It is a membrane that runs through the left atrium. In my case, it was the left atrium that robbed oxygenated blood from my lungs. I was actually in rehab. In February of 2006, I tore my ACL during basketball, and I had been experiencing palpitations, shortness of breath, extreme weight gain. I was diagnosed with benign essential tremors. And I was actually in rehab for the ACL reconstruction when I was having an episode where I was having the palpitations and the tremors, and they listened and they refused to carry on with rehab until I had a full cardiac workup. At that point, we were sent over to just a regular cardiologist, and they did an echo. After the echo, they sent me on to St. Louis for an MRI, and that was a Friday, and I was in surgery Monday morning. It was kind of hectic. I feel like I was an athlete. I played sports all year round, and scary. I can remember trying to convince my mom to let them go ahead and do the surgery because she just said no. She's like, no, and got up and walked out of the room. So it was scary because here you are one day playing basketball, at a varsity level, and the next day they're telling you that you have to have heart surgery. So it was scary. And at the same time, almost a relief because they had all of these things that were wrong or going on, and they didn't have, oh, well, that's just, your makeup. That's just how you are. You put on weight. You're short of breath all the time. That's just, you have asthma. It was very confusing until they could pinpoint exactly what was going on. Relatively normal. They explained it to me, and the way it makes sense to me is they changed the makeup of the heart. When I was born with my heart made up a certain way with a certain pressure, and then once they went in and removed the membrane, they changed the makeup of the heart. Therefore, you're changing a lot of different aspects of things that the heart, plays a part in. I guess you could say you change the hormones, I'm very anxiety sensitive. They contribute that to the change of the pressure of the heart. But other than that, I'm relatively normal. Don't be afraid to request cardiac work. The athletes that drop, we have to see it all the time. They drop dead right there in the middle of the court from congenital heart defects. I myself, my daughter, she will have a cardiac workup, and she's had, before she was born, we've been looking at the heart. So I encourage to always, don't be afraid to request, testing or advocate. If you're in a situation where you can advocate for someone else, like I do for my daughter, advocate that they don't dismiss symptoms because it's not necessarily linked to the heart.
My name is Katherine Laub, and I'm 54 years old. I work for the U.S. Geological Survey and have for 37 years. I have 2 children and 3 grandchildren. I was diagnosed with Marfan syndrome, which is a connective tissue disorder and affects the heart, obviously. I think it was about 10 years ago, was when I started seeing Dr. Spadaro as my cardiologist. Well, my previous cardiologist retired, so I was looking for a cardiologist. I actually went to St. Louis to see Dr. Spadaro, and he came in the room and we went over my history and my family history, and he said, so how long have you known that you had Marfan's? And I said, I have not. I had no idea that I had Marfan's. So he went very in-depth and explained to me what I had, and I was a little bit in shock, but he assured me everything would be fine, and everything has been fine. I have the tests that Dr. Spadaro recommends, which is to look at my heart, basically the aorta mostly, because with Marfan's, because it attacks the connective tissue, the aorta becomes weakened and ruptures and you can die. So he explained to me that if that started to happen, they would wrap it with screen and I would survive anything, more likely than not. I try to watch my weight, watch my salt, stay active with low impact exercise so that I can keep my weight down and my energy level up. When I received the diagnosis, of course, unlike everybody else, I went right to the internet and looked up everything horrible that could happen to me. I think it's good to be informed, but I don't think it's good to live your life in fear and to think of the things that you can't do. You focus on the things that you can. Both of my parents died from heart issues. Both of my grandparents on that side died from heart issues. I have a granddaughter with heart issues. So my most encouraging advice would be to get checked out often, do what your doctor tells you, and live your life to the fullest.